Cleveland Clinic, a renowned name in healthcare, is facing a very public battle. It's not about medical breakthroughs or groundbreaking research. This fight is about their priorities. A new ad campaign, launched by the conservative advocacy group Consumers Research, is directly accusing the clinic of focusing on political agendas. They claim this is at the expense of the very patients they are supposed to serve. The ad campaign is raising eyebrows and sparking debate. It targets what it deems as the politicization of healthcare. This is a hot-button issue that resonates with many Americans. On one side, there's the view that healthcare institutions should solely focus on medical care. On the other side, there's a growing expectation for these institutions to address broader societal issues. Cleveland Clinic is caught in the middle of this tug-of-war. The accusations levied against them touch upon sensitive topics. These include diversity initiatives, transgender healthcare, and climate change. These are all issues that have become increasingly polarized in recent years. This controversy raises a fundamental question. What is the role of a healthcare institution in the 21st century? Is it solely to provide medical care? Or does it extend to addressing social and political issues that impact the well-being of the community it serves? The Consumers Research ad campaign pulls no punches. It directly accuses Cleveland Clinic of prioritizing a political agenda over its core mission of patient care. The ad highlights several key areas where they believe the clinic is straying from its medical focus. One major point of contention is Cleveland Clinic's commitment to diversity, equity, and inclusion, or DEI. The ad criticizes the clinic's focus on DEI initiatives. It implies that these initiatives detract from their commitment to providing quality health care for all. Another target is the clinic's support for transgender medical care, particularly for children. The ad frames this as a controversial issue. It suggests that the clinic is promoting a specific ideology rather than focusing on evidence-based medical practices. The ad also takes aim at Cleveland Clinic's investments in climate initiatives. Consumers Research argues that these investments are a misuse of resources. They believe these resources should be directed solely towards patient care. These accusations paint a picture of an institution that is more concerned with pushing a political agenda than fulfilling its core responsibility of providing quality health care. Consumers Research has employed a multi-pronged approach to ensure their message reaches a wide audience. They've strategically placed their ad campaign across various platforms. This maximizes its visibility and potential impact. Television remains a powerful medium, and the ad is airing on major networks. This ensures it reaches a broad viewership. The campaign doesn't stop there. They're utilizing the far-reaching arms of social media. This allows for targeted advertising. By doing so, they're ensuring that their message reaches demographics who might be most receptive to their viewpoint. This strategic dissemination of the ad campaign is designed to stir public debate. It's meant to put pressure on Cleveland Clinic. By airing these accusations so publicly, Consumers Research is attempting to force the clinic to address their concerns head-on. Section 4. Cleveland Clinic hits back, defending its values and actions. Cleveland Clinic has wasted no time in responding to the accusations leveled against them. They've issued a strong rebuttal. In it, they vehemently deny prioritizing political agendas over patient care. They emphasize their unwavering commitment to providing exceptional healthcare to all individuals, regardless of background or beliefs. The clinic defends its DEI initiatives as integral to its mission. They argue that a diverse and inclusive workforce leads to better care for all patients. They emphasize that their commitment to DEI is not at odds with their commitment to medical excellence. Regarding transgender care, Cleveland Clinic stands firm in its support for all patients. They highlight their adherence to evidence-based medical practices and guidelines. They stress that their approach to transgender care is rooted in science and compassion. The clinic also defends its investments in climate initiatives. They argue that these investments are essential for protecting the health of the community they serve. They cite the well-established link between environmental factors and health outcomes. Section 5. A larger debate. Where does social responsibility fit in healthcare? The controversy surrounding Cleveland Clinic shines a light on a much larger debate. What is the role of a healthcare institution in society? Is it solely to provide medical care, or does it extend to addressing broader social and political issues? There's a growing expectation for institutions like Cleveland Clinic to utilize their platform and resources to address social determinants of health. These factors, such as poverty, discrimination, and lack of access to education, have a significant impact on health outcomes. However, there's also a pushback from some who believe that healthcare institutions should remain apolitical. They argue that venturing into social and political issues can alienate certain patient populations and detract from their primary mission of providing medical care. This debate is unlikely to be resolved anytime soon. It reflects a deeply divided society grappling with complex issues. As the lines between healthcare and social responsibility continue to blur, institutions like Cleveland Clinic will find themselves at the center of this ongoing debate.